now we are to our final section on immigrant health care. And this last section is incredibly relevant today. Currently, there are debates over Obamacare and immigration reform occurring in Congress, and there's a lot of questions on where immigrants stand with respect to health care. Okay, so this is part of not only the health care overhaul, but also immigration reform, the legislation that's currently being proposed. Okay, so first some facts, and these slides are coming from a report from the Migration Policy Institute that just came out in June, titled Healthcare for Immigrant Families, Current Policies and Issues. Okay, so 44% of non-citizen immigrants, okay, so these are immigrants who have not yet naturalized and become citizens. 44% of non-citizen immigrants in the U.S. are uninsured, compared to only 13% of native-born citizens. So if we look at native-born citizens and immigrants who have not yet naturalized, so they are non-citizen immigrants, there's a huge disparity in the proportion that are covered by insurance. Almost twice as many low-income non-citizen adults are uninsured as compared to their citizen peers. Okay. So if we look at low-income individuals, citizens versus non-citizens, 62% of non-citizen adults are uninsured compared to 35% of citizen adults. So these are huge disparities. One observation is this really speaks to some of the paradoxical patterns that we discussed earlier in the lecture segment, that we still see these better than health outcomes in light of huge differences in healthcare access. But it also speaks to how important the immigrant population is to questions of healthcare and immigration reform, because there are huge disparities in who's covered by healthcare. The lower rates of health coverage are due in part, or insurance coverage, are due in part to low coverage through their employers. Okay, so a lot of these immigrants are employed, but they do not receive insurance coverage through their employers at the same rate that citizens do. So about 40% of non-citizen workers are employed in the service and construction industries, and those industries have very low rates of insurance coverage. Okay, so this explains a large part of why immigrants have such low insurance coverage rates. And there's a lot of controversy that's come with these differentials, right? So again, in very recent debates, we've heard about this controversy, not only with respect to Obamacare and the healthcare reform legislation, but also what's coming down the pike are debates over comprehensive immigration reform. And we hear about these issues in both contexts. Now, specifically, the unauthorized population is a real flashpoint for a lot of these debates. So previously, like I mentioned earlier, most of what I've talked about looking at health patterns extends to the authorized and the unauthorized population. Okay, I did not make a distinction in the data that I've presented. So the epidemiological paradox is as evident, if not more evident, among the unauthorized population, again, which are disproportionately Hispanic and Mexican immigrants than the authorized population. But now let's talk specifically about the unauthorized population, how it relates to healthcare coverage. About 7 million unauthorized immigrant adults are uninsured. Okay, so that's about 16% of the total uninsured adult population. 16% are unauthorized adult immigrants. That's about half of the unauthorized population in the U.S. Is uninsured. Okay, the unauthorized population roughly numbers around 12 million. So 7 million of those immigrants are uninsured. About 16% of the total adult uninsured population in the U.S. And this next graphic shows health insurance coverage of adults age 19 and older by citizenship, immigration status, and nativity for 2011. Okay. And if you go across the rows, these are row percentages. So across the rows, they sum up to 100%. So if we look at the entire foreign-born adult population, we see that 46% are covered by employer or private coverage. 17% are covered by public coverage, and over a third, 38%, have no insurance coverage. Okay? And if we compare this to U.S.-born citizens, that's the second to bottom row, we see that only 15% of U.S.-born citizens lacks insurance coverage. I shouldn't say only 15, but when you compare it to 38%, it's over half of the magnitude. 23% or a quarter of U.S. citizens have public coverage, so that's higher than the immigrant adult population. And 63% have coverage from their employers. Now, if we break down the immigrant adult population into unauthorized adults, so this these are individuals who do not have, who are in the U.S. illegally, versus permanent resident adults. These are immigrants who are here legally but who have not naturalized. So they have not naturalized to become citizens, and then naturalized citizens adults. We see that unauthorized adults, around 30% receive insurance or coverage from their employers. 0% receive public coverage, right, because they're unauthorized. And almost 3/4 have no insurance. 3/4 of this population have no insurance coverage. In terms of permanent resident adults, 42% get their insurance from their employer, and 18% have public coverage, 40% have no insurance coverage. And for naturalized citizen adults, they have the highest rates of employers coverage of 58%, excuse me, still lower than U.S.-born citizens, which is 63%. Okay. So we see real differences once we subdivide the foreign-born population by unauthorized, authorized, legal permanent resident, or naturalized citizen. We see real differences in their rates of insurance coverage, with unauthorized immigrants having the highest rates of no insurance coverage, not surprisingly. Okay. This next graphic shows the same thing, but for this next slide then refers to the health coverage for children. So among low-income households, the lack of insurance coverage is more than twice as high for non-citizen children with non-citizen parents compared to citizen children. Okay, so we're talking about low-income housing with non-citizen children and non-citizen parents. They have really low rates of insurance coverage. And this next graphic shows a similar set of percentages for children. Okay, so this is health insurance coverage of the child, age 18 and younger, by citizenship, immigration status, and nativity. Okay, so if we look at all immigrant children, 36% of immigrant children receive insurance coverage from their parent's employer. And this is compared to 57% of U.S.-born citizen children. So that's a big difference. If we look at the unauthorized population, only 21% receive coverage from their parents' employers. 32% receive public coverage, so a third of unauthorized children are receiving public coverage, and 47% have no insurance coverage. So nearly half of unauthorized children have no health insurance coverage at all. If we look at naturalized citizen children, we see the biggest difference between unauthorized and naturalized citizen children. 63% get coverage from their parents' employer, which is higher than U.S.-born citizen children. And only 13% have no insurance coverage. Okay. So these are really dramatic differences in terms of insurance provision for the immigrant population, the unauthorized population as a segment of that population, and then naturalized citizens and legal permanent residents. Okay. So all of this has created considerable controversy with regard to debates over comprehensive healthcare reform and comprehensive immigration reform. So coverage for unauthorized immigrants remains far more controversial and has been a significant topic of discussion during the immigration reform debates that are currently underway in the Senate and House, with a number of lawmakers opposing access to health insurance coverage for unauthorized immigrants who would legalize under the comprehensive immigration reform legislation. So this is the idea that even immigrants, if they do receive amnesty under the proposals that are currently under debate, that these senators would not want the immigrants to be eligible for health insurance coverage. Okay, so some recommendations from the report. are that ways to improve health access for needy immigrants, particularly those admitted legally, would be to encourage states to waive the bars on Medicaid for legal immigrant children and pregnant women in the country for less than 5 years, to strengthen nonprofit community health centers that often serve as a safety net for the poor and uninsured, and to increase the use of interpreters and other language access service for those who lack English proficiency. I think these recommendations are particularly relevant in light of the patterns that we saw in the previous section, looking at the emergence of risk and what happens to immigrants with time in the United States and across generations. Okay? So that increasingly lower levels of socioeconomic status seem to negatively impact the health outcomes of immigrants and their descendants. Okay? So this is particularly relevant in the context of a discussion on healthcare reform and healthcare legislation and what happens with immigrants, particularly legal immigrants, but also unauthorized immigrants, in the context of health patterns where their positive health profiles, okay, or their more positive than expected health profiles begin to erode in the U.S. Is this really a population that we want to be taking health care access away from? And that's a question that I will leave you with today.